Gattex for subcutaneous injection used in adults and children 1 year of age and older with short bowel syndrome who need additional nutrition or fluids from intravenous feeding, parenteral support. Active ingredient diglutide. It is not known if Gattex is safe and effective in children under 1 year of age. How to use. Use Gattex exactly as your healthcare provider tells you to. Gattex is given 1 time each day at the same time. Inject a dose of Gattex under the skin, subcutaneous injection in your stomach area, abdomen, upper legs, thighs or upper arms. Do not inject Gattex into a vein or muscle. Use a different injection site each time you use Gattex. Gattex comes as a powder for injection in a vial that is used only 1 time, single-use vial. The powder must be mixed with sterile water for injection, a diluent, provided in a prefilled syringe before injected. Gattex must be injected within 3 hours after you mixed it with the diluent. If you miss a dose, take it as soon as you remember that day. Take your next dose the next day at the same time you take it every day. Don't take 2 doses on the same day. If you use more than 1 dose, call your healthcare provider right away. Do not stop taking Gattex without consulting your healthcare provider. Read the instructions for use for detailed instructions for preparing and injection a dose of Gattex. Gattex is for subcutaneous injection only, not for intravenous or intramuscular administration. The recommended dosage of Gattex is 0.05 mg per kilogram once daily, administered by subcutaneous injection. Cautions. Before using diglutide, tell doctor or pharmacist if you are allergic to it or if you have any other allergies. This product may contain inactive ingredients which can cause allergic reactions or other problems. Talk to a pharmacist for more details. Before using this medication, tell doctor or pharmacist your medical history, especially of kidney disease, cancer, bladder disease, disease of the pancreas, pancreatitis, intestinal or rectal polyps, heart problems such as heart failure. Intestinal obstruction reported. Discontinue temporarily and restart when obstruction resolves. Discontinuation of treatment may also result in fluid and electrolyte imbalance. Monitor fluid and electrolyte status in patients who discontinue treatment. Fluid overload and congestive heart failure observed in clinical trials. Side effects. Decreased appetite, trouble sleeping, cough, flu-like symptoms, or pain, redness, swelling at the injection site may occur. If any of these effects last or get worse, tell doctor or pharmacist promptly. Tell doctor right away if you have any serious side effects, including nausea, vomiting that does not stop, swelling ankles, feet, unusual tiredness, sudden weight gain, severe constipation, stomach, abdominal pain or swelling, yellowing eyes, skin, dark urine, black tarry stools, vomit that looks like coffee grounds. This medication may increase the risk of cancer. Your doctor will monitor you closely with lab and medical tests. A very serious allergic reaction to this drug is rare, however get medical help right away if you notice any symptoms of a serious allergic reaction, including rash, itching, swelling, especially of the face, tongue, throat, severe dizziness, trouble breathing.